All right, class. So we are looking at our prompt today, and it is about health information management. And we are a manager, and our department is not doing so hot. So there's several problems that have come up, lots of complaints, lots of different people complaining. So we're gonna try to sort that all out. And the way we're gonna do that is we're gonna use kind of the 5 whys, and we're gonna make some diagrams. So I made a few simple drawings to try to kind of organize and to kind of see if we can find some solutions. So the first one I made, let's see here. Hopefully you can see it, is like this. And it's pretty simple. You can see we have our department here. We have the receptionist, people taking the phone calls, nurses, physicians down here. And what I did is I made a list of everyone who has a problem. And so this is the list of all the problems that everyone had with us. And then there were a couple of other problems with the receptionist, and then the clinical staff I kind of left alone because they didn't really have a whole lot of problems, or at least not that we're aware of. So the first thing we did is, we have you see some things that are grouped up with some Ys, and I grouped them up together because I think that they are kind of intertwined, and if we can solve one, we can probably solve both. So the kind of first why is, why are things taking so long? So why do nurses have to wait so long? Why does it take so long to get records out? So for that, we were looking at solutions, and for one of the three things we were looking at here is, what do we do to make that better? Do we need an electronic health record system? Is it all on paper? Hopefully it's not all on paper, because if it is, it's really, I don't know. I guess it's possible, but that's not the greatest system. But we also can't always just throw money and buy a whole new system. So if it's all on paper, then there needs to be a set of rules. Like, you can only take what you're working on. Maybe we need to make alphabetical files and just make everything really easy to find, because that should not be taking a long time. It should definitely not be taking away from patients' time, and it should be something that everyone can use. If it's an electronic health record system, then we need to train people to use it effectively. So, why are, it should be a matter of seconds to look someone up. You should have name, date of birth, and you should be able to find it. Nurses should be able to find anyone who needs it should be able to find it. So if that's the issue, then we need to figure out, is the training not enough, and how to fix that. So yes, that's the first thing for saving time. Next thing we're gonna look at here, so they're saying that they're not answering calls. There's no additional help. And that might all be true. So we want to ask, why is that all happening? It could be because they really do need more help. It's a big clinic, and maybe they're understaffed. Again, that means more people, and that's not always the solution. Is not getting more things, because that costs money. But hopefully that's an option in this case. So for that second solution, more help. Is the work too much? The clinical, the HCM people are saying, they feel like they have more responsibility. We need to ask what that is, why they feel like that is. And so we'll need to figure out, what's keeping them. Hopefully it's not laziness, but the reality is sometimes it's the case. And if that is the case, then we need to retrain or let those people go. That's kind of the reality sometimes. And if they need more help, maybe they need stations. Does one person just answer calls? Does one person just find charts? What needs to happen to make that go faster? And then another problem we had is the rudeness, and I kind of put that in with the defensiveness of the receptionist, and want to figure out why that's a problem. Really, rudeness really doesn't have any place in kind of a professional setting. Solutions for that, again, back to the paper here, so more training. Do we need to have classes on how to treat people nicely? That's kind of a bummer, because that's something that really should be everyone should know, but sometimes it's not the case, and you need to train people to kind of understand how to be professional. Rudeness, unprofessionalism, all that has to go. It's a professional environment. It has no place there, and I would replace those people if it continued to be an issue. Yeah. And then with the more training, make sure that the clinical staff, the nurses, the physicians know how to use what they need to know to be able to access patient records. And train the receptionist to figure out what calls are okay, because I know where I work, we do have that problem where we get a lot of calls and a lot of things end up back where they shouldn't be. So this is a simple diagram. Could have definitely gone way into more depth, but for now that's kind of the simplicity of it. We could definitely go into it much deeper and come up with much more solutions, but for now we'll leave it there. So have a good week.